Taoiseach, you've said this is about accountability, it's about a breach of trust. I also want to argue that it's also about the privatisation of women's healthcare, and that when we go and delve into the inquiry that is promised, that we have to look at how outsourcing since 2008 has impacted on the results of the screening and has led to women dying as a consequence. And has also led to an award by a private company to Vicky Phelan. Why else would they pay her off if they weren't guilty? We've also asked for a breakdown of the final 208 false tests to show what clinics they came from. But look, I want to preempt what I'm going to say by saying to every woman out there, we must stick with the programme of getting cervical check. It's really important that women stick with that programme. And I'm not playing politics when I make this point, but we found out yesterday that the State Claims Agency received a request in January for her files. They then knew in March, the head of the National Screening Programme knew in March that there was a claim going to court. He kicked it up the line to the head of National Screening, and they kicked it up the line to the department, who knew in March. The Minister didn't know. Right, I just make it simple for everybody who's here. That is a diagram of the transitional organisation structure of the HSE. I've coloured you in blue to match the colour of your shirt, Minister. But this here is the Risk Committee, answerable to you. This here is the Director General, Tony O'Brien, answerable to you. None of them told you, but you are the boss. You're at the head of all of this. None of them told you, but none of them are fired, none of them are suspended. Go right down the line to where the information first came in. Nobody is in trouble for this. I know a young worker, a young hospital worker, who was suspended for 2 months because she criticised HSE spending and the trolley crisis on a Facebook post. You have to make head roll in that department for failing to tell you, for failing to be accountable. If you don't, you should go, Minister, because somebody has to go here. And I don't believe you that you didn't know. I don't believe Tony O'Brien. And I don't believe that your department isn't full of people who are trying to cover up. And if you believe that they aren't trying to cover up, that they're all innocent and they're all okay, then you are failing to do your job. That's you at the head of the organisation. The fish rots from the head, Minister, and you need to deal with it, or else you need to resign.
Respond.
Deputy, I think we all have to try to work together here to get to the bottom of this and reassure women across the country. And I do want to welcome the first thing that you did say in relation to encouraging people to continue to believe in and to continue to use the screening systems that are there. But we are reaching out to opposition spokespeople, as the Minister did yesterday. My understanding is that you were the only person who didn't agree with the way forward that has been charted from yesterday, and that's your right, of course. But we are listening to other perspectives here in order to try to put or to create consensus around the most appropriate way forward. Can I say that I do not think it's credible to suggest that the Minister knew about this before it was public. He has responded in a way that has put multiple changes in place immediately, as well as putting a huge sense of energy and urgency into the system to try to establish facts. He has been frustrated in those efforts, which has been hugely difficult to manage from a political perspective, but as he said, his problems aren't the issue here. The issue is the problems facing families and women today, which we need to put right. And we will. And people will be held to account. But we need to establish the full facts first. This is not something that we should shoot first and ask questions later on. We should establish an understanding publicly in terms of how this happened, whether it was a cock-up, as the Taoiseach said yesterday, or some kind of conspiracy, which I doubt. But until we have the full facts independently put in place, then I think we should be careful in terms of what we say and who we blame. And I do not think that sense of natural justice should be set aside here because of the anger, understandable anger and anxiety of people. In relation to the outsourcing, as you say, of testing, let me just give you the facts so we have them. As regards the laboratories, currently the testing for cervical smear tests is carried out by 3 institutions. Quest Diagnostics in New Jersey, in the US, MedLab Pathology Limited, which is a US company but based in Dublin, although the testing takes place in a lab in the US, and the Coombe Women's and Infants University Hospital, Dublin. As the Taoiseach has confirmed both yesterday and on Tuesday, 50% of the testing is done here in Ireland and 50% is done abroad. And at the moment, we have no reason to believe that the test results in terms of the numbers of false negatives or false positives differ to any significant degree between the laboratories. But that is something that a new independent inquiry will have to establish, so that we can see if actually the decision to outsource was a mistake or not. Some people believe it was, others believe it wasn't. But we can't make judgments on those issues in the face of the emotion of this debate. We need to make judgments on these issues that protect women on the basis of the facts as they are put together over time. And that's the way we should approach this.
1 minute, Deputy Brid Smith.
There are many things we know without the inquiry starting, and one thing we do know is that the CPL tried to gag Vicky Phelan, and she wasn't having a bar of it. The CPL is the sister company of MedLab in Sandyford, and we are still using them to screen women's cervical tests. Now, supposing I accept the bona fide of the Minister Simon Harris that he didn't know this. Let's say we all accept that. There's still a problem, because we know that his CMO knew it and that the department knew it, and they didn't tell him. And he is, as I pointed out, at the head of the chain. He's at the head of the food chain. He is the fish with the rotting head, and unless he does something about it, in natural justice, you mentioned natural justice, in any industrial relations or investigative circumstance, once an investigation begins, there are suspensions. People are suspended while the investigation is taking place. I don't think you can properly investigate this while the people in the department who did not tell the Minister are still in situ. It is just against natural justice to do so. And if Simon Harris doesn't do that, or you don't do it, or Leo Varadkar doesn't do it, then you're complicit. All of you are complicit. But heads have to roll. And Minister, I really plead with you to discipline the people who fail to tell you, or else you should resign. It is not credible that you can stand over a situation like that and young women in hospitals get suspended for a Facebook post. Why is somebody not going from your department when they fail to tell you?
Tanis, just 1 minute to respond.
The people who are in charge of cervical check have been moved aside. That's the first thing. There is a new management team in there now on the instruction of the Minister. That management team, just listen to the answer, please. That management team is reporting on a daily basis to the Director of the HSE, who is reporting on a daily basis to the Minister now on progress on this issue. So we have a Minister who is taking a hands-on approach towards progressing this issue properly. In relation to the lack of information flow for the Minister to be able to inform the House as things unfolded over the last week or so, a lot of that information, I understand, was put together last weekend because the Minister sent in audit teams essentially into hospitals to go through files to make sure that we had a clear understanding in terms of the numbers involved and so on. And subsequently, contact has been made with women and families who clearly should have had information a lot earlier and didn't get it. So this is, in my view, likely to be a situation where advisers to the Minister didn't have the information. It wasn't that they were withholding information from him. And we have to look at how a management system within the HSE can allow that to happen. And that is what...
Deputy Smith, please. Deputy Smith, you've had your opportunity.
That is why, Deputy, you know, if what you're saying is correct, we will have that confirmed by an independent statutory inquiry when that is set up, and we will be able to make informed choices and learn lessons on the basis of that to allow us to put new systems in place to make sure that we don't see a repeat of what happened over the last 7 days.